the path in terms of achieving optimal results really depends on several factors. And it's not necessarily the axis of time, because many of these important factors happen at the same time. Sometimes they happen multiple times throughout treatment. But in order to get optimal results, I identified critical factors that I wanted to share with you. So they say timing is everything in life, right? Timing is everything. And it's also true in regards to extractions, because it's extremely important to extract teeth at the right time. Meaning, don't wait for a huge blowout to occur. If you identified a localized 10 millimeter pocket on a central incisor, and the tooth usually has endodontic therapy, and you can identify a vertical root fracture, don't wait. Don't wait for this to be a blowout. Don't wait for the buccal plate to completely dissolve. Don't wait for the fistula to occur, because the longer you wait, the more bone damage, the more soft tissue damage, the more difficult the extraction, and the more compromised your optimal outcome. So the timing of the extraction, once you identify the problem, meaning rendering a tooth hopeless, meaning the tooth is cracked beyond repair, extract it ASAP. Extract it immediately, because the longer you wait, the more damage. And please express this to your patients, because your patients sometimes will be funny about it. They'll say, doc, it doesn't hurt. It doesn't hurt me. And, I don't see any reason to extract. So please show them some photos of teeth that had a blowout where there's no buccal plate. And if you don't have the photos, email me, I'll send them to you, okay? So the timing of the extraction is extremely important. Now, your extraction technique is also critical. The less invasive you are, the less traumatic. I don't say atraumatic, because extractions are a traumatic process. You are removing a tooth structure that is connected to the jaw bones with ligaments and other attachment mechanisms. So be as atraumatic as possible. The proper extraction technique is going to make a big difference. And I'm going to share with you a couple of extraction tips. The bone grafting technique that you're using, not so much the type of bone, although that makes also a little bit of a difference. The bone extraction techniques make a difference in regards to preparation of the implant site. Of course, the soft tissue management and soft tissue grafting also make a difference. Now, once you built up your implant site and you created an adequate site for an implant, it makes a huge difference. What is the axis? Are you going to go with a flapless approach, with a punch technique? Are you going to flap it? And if yes, what type of flap? These are important things. And what are you going to do with the flap? What type of tissue manipulation can you use in order to maximize the aesthetic outcome? And also from a health perspective, good tissue is also a predictor for long-term implant health. So don't underestimate the soft tissue. And I know 50% of all doctors have problems with that. Now, you can extract the tooth beautifully. You can do it at the right timing, build up the site, create a great implant site, have a great access and good tissue manipulation. But doctors, you can mess it all up if you place an implant inaccurately and you place it in the wrong position. And I've done this several times. Mostly at the beginning of my career, at the beginning of my learning curve, I had problems with accuracy and precision. And that's why I'm so focused on not only building a good implant site, but also placing the implant in the right, proper restorative position. And last but not least, your restoration will also have an impact on optimal outcome. Here's the nice thing about being good about what you do. To improve your knowledge and your ability to create good strategies and skills. Because what is the difference between someone who has very minimal skills or no knowledge to somebody who has high knowledge and high skills? If you have high skills, you will have high compensation. You will have raving patients. You will have a practice that is growing. Why? Because you created value.